So this is our hybrid meeting of the chapter. And I want to recognize as well that I am president of the Vancouver Island chapter, Doug Jones. It's a pleasure to have you all here in this is St. Elizabeth's Church meeting room. Delighted to have those of you who are online as well. And for those of you who will be coming in later with the YouTube recording, which should be out in approximately a week. We also thank Melanie Urich for helping out setting up the meeting and getting us associated with us here. And I think it's very important as well to acknowledge and respect the many nations of Vancouver Island and the Canadian Gulf Islands of the Salish Sea, whose traditional territory CARP Vancouver Island Chapter 19 operates, and whose peoples have historic relationship with the land which continue to this day. It's my delight now to introduce our guest speaker for today. Dan Levitt is a BC Seniors Advocate, and he's going to provide some of his aspirations and perspectives on objectives for the BC seniors. And it's particularly important right now with the upcoming BC election, which all of you I'm sure are aware of and will vote, since 95% of the people in CARP actually vote in the election. So I think that's a very important part. So I first met Dan online, and then in person we had some discussions about some issues of mutual interest, and I was really excited to hear his passion on the issues and many of those that affect the seniors in BC and things that we want to accomplish in the short term and in the long term. So I'm really delighted to welcome Dan to the podium and have him speak, and it'll take me just a minute to stop sharing my slides and start his slides, and then hopefully you'll be able to hear him speak. So Dan, if you want to go ahead.
Well, thank you very much, Doug, for the honor of that introduction and the honor of being here. Really appreciate our time together. Please ask questions along the way. If you want to save your questions at the end, I'm happy to answer any questions at all to do with any topic related to older adults. At all, anything at all you want to talk about. The land acknowledgements I wanted to mention. A few weeks ago, I had the privilege of attending an elders gathering. This was an annual event that happens in downtown Vancouver, at the convention center, and elders from Indigenous, from First Nations, from around British Columbia came from all sorts of different places I'd never heard of. And they basically did a procession through a huge space, a huge convention center, and it was just amazing to see how proud they were. And this is simply an opportunity to honor our elders, which is fitting because where are we right now? We're in a church, and I grabbed a copy of the Bible, and anyone who's ever read the Bible will know in Exodus it talks about the 10 commandments, and my favorite commandment is number 5. And they know which number 5 is? Sorry? Thank you. So this is all about that. This is all about honoring the grandparents, honoring our elders. And I think when we focus on that, we focus on older people. It actually says if you do that, if you honor your parents, you will live longer. Wouldn't that be nice? And just by the way, this is being said for in this space. You think about if you know the Bible, the first person to ask you something incredible was really old. Noah, as old as could be, right? I think he was like 700 when he was asked to basically build this. And then one thing, just some people say, oh, they found something new about aging. Read Ecclesiastes 12. And it describes the aging process. This is 1,000 years ago. It described Parkinson's, describes some gait disturbance, some walking disorders. It describes hearing loss, describes changes to vision, and it even describes loneliness and isolation. So it's thought that's something to know. So how did I get to where I am today? The picture of the couple there with the plant. I was sitting in a classroom at UBC, and for my undergraduate, I did a degree in psychology. And one of the courses available was psychology of aging. So I thought that'd be an interesting topic. Grandparents, and just lost my great grandfather. So I wanted to learn more about the aging process. And the professor showed back then it was a slide projector, right? And she put a slide on there and talked about the study that these two social psychologists had done in New England, in upstate New York. Judith, I think it was Judith Rodin and Helen Langer and Judith Rodin. They went into this nursing home, and in the first floor of the nursing home, they gave everybody a plant like this, and they said, "You're responsible for this plant. You got to make sure it gets watered, it gets fertilized, it gets sun, and we're going to come back and check on this plant, and we expect it to be flourishing, to be vibrant." They called that group of residents in the nursing home, they called that the experimental group. On the second floor, where they were assuming homogeneous groups of people that these aren't heterogeneous in their diagnosis, etc. We'll talk about stereotypes later on. But on the second floor, they gave every resident there, every older adult, they gave them a doll, and they said, the staff are responsible for this doll. We're lending it to you. If you lose it, we'll replace it. If it gets dirty, we'll clean it. So the social psychologist left. A few months later, a few weeks later, they came back and they checked on the seniors. They first went to the second floor, as you might expect. On the second floor, those residents, actually one of them passed away. Some of them had some what we call bed sores or pressure ulcers, decubitus ulcers, from not moving enough, from not being active enough. They were on more medication than they were before. They had lost weight. They weren't doing as well, or they were declining as maybe you might expect in a care home. But on the main floor, you can probably see where this is going. On the main floor, those residents had all the opposite outcomes. They were flourishing. They were vibrant, just like the plant they were caring for. They had a purpose to exist. In a care home, most of the time, your life is you're dependent on somebody else. You're dependent on somebody else for just about everything. You've lost so many things. You have very little, of those things that you do for yourself, and you're certainly not responsible for anything else. They called it responsibility-induced group, and from that moment, I thought, wow, if I could be a CEO of a care home or administrator of a care home like my dad was, what could I do differently? How could I influence? So I did that for 30 years, and I think we did some fun things. So one little thing we did was, if you go into a care home, or you can go online and see this, you'll see people who can't swallow solid food anymore. It's called dysphagia. It is a condition that's often associated with Alzheimer's or dementia. Part of that disease process. It's one of the outcomes that happens. So what do? We blend the food and put it on a platter. Have you ever seen this stuff? Baby food looks much more appetizing than what we do for seniors in care homes. Sorry, word I was going to say, I won't say the word. So what did we do? So the last place I worked, I asked the food service manager, I said, can you make this food look like the actual food it is? Because there are restaurants you can go to, probably in Sydney, if you have a few dollars, and they will take some kind of food of some kind, some food item, and I think they call it, there's a cooking term for it, but they will emulsify it. And then they'll serve you something, say, yeah, this is a steak, or this is something, and this is broccoli. That's a broccoli? No, we made it look differently. So I said, can you do that with this food? And so I don't have a picture with me today, but we made spaghetti meatballs, or they made spaghetti meatballs look like spaghetti meatballs. The staff didn't believe it was the right food. They said, I can't serve this. This person has dysphagia. They can't swallow. He said, no, so it looked that good. A piece of we even did chicken, and the staff, or the resident actually picked it up, and then it falls apart. So it's called ITSE's level 4, and they could swallow it. And so we wanted to dignify seniors, to honor seniors. So that was kind of my inspiration. And when I found out Isabel was retiring, I applied for the job, and here I am. So I'll do the next slide. Oh, sorry.
You can just roll it.
Okay, I'll let you do it.
There you go.
Okay, so a little bit about the Seniors Advocate Office. If you don't know about us, our mandate is 65 plus. Before the office was open or created, they did a consultation process around the province. I think I went to the one in Chilliwack because I was working out in Valley, and that's where I learned a lot about the look in front of me. Wondering where I learned about it. So they did a consultation process, and one of the questions was, what's a senior? I'm 55 today. Am I a senior? According to the Act in British Columbia, then you're a senior at 65. We're going to talk about if you'd like later on. So we make recommendations to government. A lot of the concerns that I've perceived that have come up that Isabel in the office has looked at in the past and that we're looking at now are really government being accountable. That so what do we do mainly? We do outreach and engagement like this event today. We monitor senior services, so anything from long-term care, which we've done a lot of work on, assisted living, housing, which I think will be asked. Someone else asked me a question about that later on. We look at, are there enough physicians for seniors, palliative care, hospices, vaccinations, anything to do with healthcare. We look at transportation, as you can see there. So everything from handy dart to we're very concerned with the strike right now going on. Handy dart, are there enough handy darts in the province? Public transportation, and then what happens when you lose your driver's license, and why, you can talk about this too, why do you need to go get a medical examination for a driver's license at a certain age? We can talk about it later on. We look at income, so the BC Senior Supplement, the federal income that you get from your OAS and GIS and CPP. We also look at community supports of things like some of the work that Beacon does, but also you've probably heard of Better Home, so you can age in place those services. So that's and community centers like the Shoal Center, etc. And what else do we do? We look at systemic issues. So if somebody calls in with an issue, we won't take their issue all the way through to the end. We'll direct them, and we'll ask them to get back to us if they don't get the right help. But when we see a trend, that's where we will investigate further and see, is this something that is happening across the province? Because sometimes, I know at least one of you here told me about a story, a situation, and if one person has an issue living in a building of 100 other seniors, maybe all 100 seniors have it. So that's where we look at those things. And we also do an information referral service, which is very well used, and we help to direct seniors to get help. That's what the office does. There we go. Okay, so a snapshot of seniors in British Columbia. So today, there are almost 1.1 million seniors. So that's 1 in 5 British Columbians. There's 5 million British Columbians. 1 in 5 British Columbians are seniors. By the way, my job, our job together, if you go back to commandment number 5, is to have all the other 4 million people who aren't seniors care about seniors, that the seniors' lives matter as much as anybody else, and never to discard or make you should never feel invisible because of that. So then in 12 years from now, there'll be 1.5 million seniors, and by then 1 in 4 British Columbians will be a senior. So we've got 12 years to do something about this. Please.
So is that because of people moving here? Because we're not reproducing anymore.
Yes, those are the reasons. It's the demographic. People are living longer. We're not having as many babies, and yes, with immigration, people are still the immigration numbers are still supporting that inverted pyramid, where you have more people on top of the demographic than below.
Okay.
And there's things like medical technology helps, advances. There's different reasons why people are living longer.
Okay.
The oldest baby boomer today is 78. In 12 years from now, the oldest baby boomer will be 90. And one of the things to keep in mind is 85 is that number of the age when 1 in 3, well, I'll show you stats. Oh, you can see the stats I'll show you on the next slide, but 1 in 3 seniors at 85 requires care, either in assisted living, long-term care, or at home. The other third of the seniors are providing care to that person, supporting that person. The other third, you're thinking that might be you. Well, they're dancing and romancing and wishing the music would never stop. They will never step foot in a nursing home, and they'll never have to support somebody else. I think our job really is that those 2/3, the one in care, retiring care, and this person supporting them, they are the lucky ones. Okay, that's what our job is. Then, so the 85. So you see 11% today, 17%. So the good news is we are living longer, and certainly places like Sidney, and there are some other pockets in BC where people live for a long time. The seniors than others. Okay, so there is a perception that if you live long enough, you're going to end up in long-term care. As I mentioned, there's no guarantees you're going to end up in long-term care. You may not need long-term care. There's a perception that you're going to end up in long-term care and have dementia. Okay, if you live long enough, you do not have a guarantee of getting dementia. If you can't remember what you had for lunch today, or for breakfast, or what you did yesterday, does it matter? Don't worry about those things. Worry about other things. So my take on memory is this: that your brain has so much space, like a filing cabinet. Okay, think of those files. When your brain doesn't allow you, even though you try to block out those memories you do not want to have in that space, you'd love to extract them out. You can't do that. So your brains are full of information, and that's why you can't remember that thing that you would like to remember. So that's my own theory about memory, and so it's not a natural part of aging. Dementia, okay, it's pathology that happens in the brain. So most seniors live independently. 95% of seniors live independently. 77%, so 3 out of 4 after age 85. And the next slide basically is what I talked about, 1 in 3. You're adding up the numbers, you're saying those don't compute. So if you add in the home care piece, it comes to a third. 80% are homeowners. Means that the property tax deferral program is, I believe, and I wrote a piece about this and will continue to promote it. I think it's a very good way for seniors with affordability challenges who own a home to defer their taxes. And a lot of us don't like the idea of taking on debt. I'm from a generation myself that I don't like debt, period. We pay for our Visa bills every month, credit card bills. We try to pay our mortgage as soon as we can. And why would I take on more debt? If you look at the interest rate and look at putting that money into your pocket, we think it's a good idea. And we also think, by the way, that seniors should be able to stay in their home as long as they want to, and that no one should ever tell you, even though you might have some close relatives that would like you to do otherwise, to either sell your house and move somewhere else, or stay in there until it's beyond where you'd want to stay in. It's really your choice. It's your house. So, but 1 in 5 seniors rent, and that's really what we spend a lot of time and energy on, is rental housing, and we'll talk about that in a few slides from now. And that's a big concern of ours, is around the income supplements for renters, especially low-income seniors, and just the availability of senior housing, which I believe is a big concern of ours. So interesting that 14% of seniors are employed. We can talk about ageism and age discrimination here, and point out that if you know a senior who's working in a job right now, ask them, and maybe it's you, ask them about their benefits. Seniors in British Columbia, I believe Canada as well, do not get the same benefits as people under 65. 65, you lose benefits. You lose your disability benefit, you'll lose your life insurance, or it gets decreased. And I think it's 71 or 72, you no longer get a work-life pension. And somehow that's legal. I don't understand that, but it's blatant age discrimination. You might say we can't afford it, or that's something we're certainly have our eye on, and I think it needs to change. And by the way, it's not just for seniors today, it's for seniors of the future. Because younger people, my understanding, I have two younger people in my life, one's 19 and 21, and they're very worried about ever being afford house, or ever being able to afford a lot of things that a lot of us have been lucky and blessed to have. So they might have to work much longer, and they'll need those benefits one day. 41% are volunteers, and when I toured the province in April, I realized that much of what happens, and CARP's a good example, is done by volunteers. And without seniors volunteering, I don't know what happened. In particular, seniors supporting other seniors. It's pretty cool. I'll talk about driver's license. My dad's 87. My mom's 81. We're having dinner at their house tonight with our older daughter who's 21. And my dad drives. Our younger daughter, and she's not listening, I hope, to this. She's 19. Okay. My dad's 87. Guess which one had a car accident past year? Guess which one had to go to their doctor in the past year and pay? I'm not sure what he was charged, but I've heard some seniors paying $280 out of pocket to get a medical examination because of the year they were born, not because of their abilities to drive or not. Okay, just think about that. And let me we have our eye on having the medical services come in, cover that, and having no extra billing. So the driver's license is certainly yes.
You're speaking about a driving exam.
Yes.
Medical exam.
Medical exam, not actually. So it's interesting. Thank you for pointing out. It's a medical exam. Your fitness to drive, your abilities, your alertness, your reaction time. It's not about do you know how to drive your car. And by the way, just when you're driving around, and I'd love you to contact our office when you see this, look around about things during the day or during the night you might find on the road that could be improved. Someone mentioned this to us yesterday, a retired physician who's probably in her 70s. She mentioned this negative really. What could Ministry of Transportation do to make the roads safer to drive on for all of us, so that perhaps if you're on certainly driving from here to Victoria, for example, or here to the ferry to Swartz Bay, could they, or even the roundabouts, are the barriers clear enough? Could they be more accentuated with different painting or different colors, reflectors? And the last is, as I mentioned earlier, 5% of people are diagnosed with dementia. It's very serious if you get diagnosed with dementia. And I just want to point out that when you start hearing about numbers are growing, etc., look further into the details why they're growing, why that's happening. Yes.
So the drivers say I've heard from somebody who was in school military, they have to actually take a physical driving test for getting a car and drive. It's a much longer test than a new driver. Test. Why would that be?
You tell me. I think it's a lot of. Yeah, I think so too. And then so one solution might be, I'm not coming here with all the problems, I'm giving you solutions to one solution might be at a certain age, or sorry, let me back up. If you started in your teenage years driving, maybe every 5 or 10 years they check in on you. Thank you. More, I was going to say DMV. That's the United States one. So yeah, the more people look fast, just check in on you. Well, why do it at? I know people probably thinking the seniors advocates here. I don't want to say anything ageist, but yeah, you might say a 97-year-old but maybe it's the opposite. So yeah, that doesn't seem right. And by the way, it's I was talking about this in Abbotsford, and one of the city councilors, Len Barkman, says to me, he says at 65, he operates a large agricultural vehicle in Saskatchewan every summer. He goes there and helps out his family, and so he has to go get a test at 65. And he imagine if he said, Len, what will happen if you don't do this? If you don't pass, or you decide, screw them, I'm not going to do it. What happens? Who's going to actually do all that work? It won't happen. And that becomes it was grain. and that becomes food. So, okay.
I suggest you hold your questions to the end, because we also have some coming up in the chat, and I want to give them an opportunity as well. Thank you.
So our number, I'll try to be a little faster. Our number one issue is affordability. That's what I've heard the most about from seniors is the affordability crisis. Remember that seniors, many seniors make, well, here you go, that third bullet point down. 1 in 4 seniors, 25% of seniors are making less than $23,000 a year. I don't have a calculator, I forgot the number, but there's a stat we have in our office around how many seniors in British Columbia are living on less than somebody working full-time on minimum wage. So then you think about what happens when you throw a senior, when they get rent evicted or they get to leave where they're living, and now they're in a pool trying to swim, and they're fighting for the same housing that somebody who's working is. Good luck, right? So there's for sure inequities there. The BC Senior Supplement has not changed, and it should be adjusted for the cost of living. The first bullet point there for low income, it's not doing the good enough. It was doubled recently. I think in the past 5 years or so, it's doubled from $50 to $100. I go to Walmart in Victoria and try to stretch my dollars there. But I can tell you how much food you can buy. And I'm talking about buying $1 tuna cans and from Walmart. You see how much you can live on, how far that takes you. The SAFER program. So SAFER is for low-income seniors who are renting, and there's income caps, there's rent caps, and there's even the subsidy piece. So we think that the whole program is woefully inadequate. The goal of the program, according to the Ministry of Housing, is to cover 30% of your housing costs. It does that for very few people. So it's not working. And because of the SAFER program not working, there's tremendous pressure on housing, seniors housing for that. If you had the SAFER program working, seniors would be fine living in a lot of places. But if it doesn't work, seniors housing is incredibly challenged. It's the wrong way.
Yeah,
you did say towards me. You did say that. No, now it's stuck. There we go. Are you doing that? Am I doing that?
You're doing it.
Okay, seniors population growth. So we're not doing enough to meet the needs of seniors today or in the future. We have to do a lot more. So we definitely have to construct more affordable housing. Where we want to see when I look at budgets or look at political platforms, I'll look and see. I've always done this. I'll look at how much affordable housing is being built for seniors. And when you say affordable housing, I want to see it. I want to see seniors. I don't want to see seniors and other groups. I want to see seniors. Subsidized long-term care. We'll talk about that in a little while. But think about if you live in Sidney. Think about how many long-term care beds there are in Sidney, and think about anybody that you know who's had to leave Sidney to get long-term care. And I can tell you that when I toured the province in Cranbrook, we had a woman who lives in Cranbrook. Her husband lived there all their life. And if he needed long-term care, he gets sent to Fernie, which is a half an hour mountain highway away from the city. They're separated. I thought that wasn't happening after a case that happened about maybe 2 decades ago in the Kootenays, the Al and Al Albo case, where they were separated and died apart. So this guy is living in Fernie in this care home, and she only visits him in the summer or in the spring when the roads are clear. Won't go on a mountain road, and so because she's lost 2 close family members. So now and I can keep on going with long-term care. Okay, assisted living. It's a great program. We need more of it. There just isn't enough. The wait list continues to grow. So my concern really is how long do you have to wait for a long-term care bed? Because long-term care doesn't fall under seniors care generally doesn't fall under the Canada Health Act. Believe it or not, there's no national standard around how long you should wait for a care home bed. I have my own ideas how long it should be, and our office is researching what would be the number of beds we need to build in order to have a reasonable wait list. And then the last thing is just better coordination for senior services. There should be one place you could call, one number to call, and be able to have basically a concierge service from beginning to end, if you will, to the finish line, and perhaps for your family members beyond. The next slide, I'll just. There we go, aging in place. So you can decide. My question today to you is aging in place a myth, reality? Can you age in place in BC? We have enough home support. So home support includes cleaning, cooking, laundry. We call those things IADLs, instrumental activities of daily living. It's really insufficient. It's a better home program. And it's not available in many communities in BC where it's available. There's long wait lists and there's lots of challenges. In the Shuswap, for example, if you think of where Chase and Salmon Arm are, around there's lots of small communities, very indigenous, remote, and they lack those services. So people are basically depending on their neighbor for support to get by. I won't repeat the next. That's we've already talked about that. But just you think about downsizing. Just as a note, when you go visit someone in care home, if you know anybody in long-term care, when you go visit them, you're visiting them in their bedroom. Can you think of any other place in well, maybe a hospital, but that's temporary, where you go visit somebody in their bedroom that you're not? So are there enough community resources? We talked about that. So there are gaps of duplication. I was talking to some of my colleagues that are in the room earlier today, and if you well at the Shaw Center, I'll just tell this. I don't know how many different programs and contracts you have, but every year at the Shaw Center, the leaders there have to apply to so many different agencies to get funding. If we really honored seniors, if we really honor their mother and father, we would be providing one lump sum money, and that would be an ongoing contract. There'd be metrics, there'd be measures, there'd be accounting, but we would do it that way. The shingles vaccine. Right now, there's no coverage for the shingles vaccine. It's available, but it costs money. So here's what we did. So we found out, and then we released this report in June on Seniors Week on purpose. We made these recommendations. The first was we want immediate financial relief for low-income renters. That's around the SAFER program. We recommended certain improvements. We think they went maybe halfway on their recent improvements. We'll put pressure on them until they do more. We want to see that improve dramatically. The next one, the senior supplement I talked about. We want to see that at least index to inflation, if not increase as well. For home support, if you are getting home support right now of 1 hour a day and you're making $31,000 a year of income, we're going to charge you in BC $9,000 a year for that 1 hour a day of home care. So now you're going from $31,000 to $22,000, and how are you going to survive on that when you're in the same renting pool as people working full time? So we want to. So in Alberta and Ontario, they do not charge for home support. There's no co-payment. The shingles vaccine. I know our provincial public health officer. He told a group of seniors yesterday at a meeting I was at, where I know we were really close to getting that funded in the last provincial budget. Unfortunately, it got dropped at the last minute. But she will do everything she can, as will we, to have that particular vaccination. The math work. If you have 1 in 3 British Columbians will get shingles. More likely to get it as you age. There is, I think the age was 65 is kind of the magic age to give the new shingles vaccine. It's much more effective than the previous one. Basically, shingles is when the chickenpox virus wakes up, and it's those nerves. And if you try it, it's debilitating. It can cause blindness, etc. So here's the cost, the economics. If 3 people, so 1 in 3 will get the shingles. So if you vaccinate 3 people, the cost of the healthcare system, including giving the vaccination and everything else, is $1,200. So for $1,200, we can vaccinate 3 people, $400 each. We want the government to cover the whole cost. They're covering part of it right now, but not the actual vaccination. And as we do that, think about the cost savings of the healthcare system in future. So it's a no-brainer. In a public meeting, Shirley Bond, who just retired from Prince George's MLA, She spoke of her own experience with this and told me personally her story, and I know what I'm going to do when I get when it becomes free. And the last thing, and it sounds far fetched, but I think we're going to do this is with the new government, whoever the new government is, we're going to have a cross ministerial committee and process to look at how to improve services for seniors. I'll just go through this a little quicker than the other ones. So here's what we found out. The call center. We look at the trends of who's calling in, what they're calling in about. We found out that over from 2022 to 2023, the number of calls doubled on one issue, which was retirement homes. These are places where you rent a room and you have mandatory service package, meaning when you rent, you're obligated to purchase housekeeping, laundry, and food meal programs, $5,000 a month. Yes, David. Okay, so that's what one place charges a few blocks away. So what we found out was that the complaints were that they were charging up to 24% increase on that package, in particular on the service package. So we looked at the issue, we read and studied, as did our lawyers, studied the Residential Tenancy Act, and we found out that if you make it mandatory for if I am renting, I'm a renter right now in Victoria. So if I rent a place there and my landlord says, I'm going to give you a parking space, it's going to be $50. You're required to take this parking space with this apartment I'm renting to you. And then on a year later, when when he is allowed, or the landlord is allowed to increase the rent by the allowable rent increase, which this year is 3.5%, next year is 3%. And by the way, that's calculated on inflationary costs. And it's always above inflationary costs. So if your operators talk about we can't manage anymore on the amount of money that we're getting, we question that because everything is included in there. All their expenses are included. Their food expenses are included. Labor's costs are included. So the overall inflation in the past 12 months has not increased more than 3%. It's just 3%. Anyway, so we looked at this and we thought, okay, we're right on this issue. So we issued this report, released a report. A week later, we released a letter we got from the Ministry of Housing saying that we're correct, that the Residential Tenancy Act says that that 3.5% increase, the allowable rent increase, it applies to the service package because your landlord making it mandatory. That parking space I mentioned, if my landlord says you have to buy the parking space down for $50 a month, he can't next month he can't next year say I'm going to increase, or at any point say I'm going to increase that up to $100 because the allowable rent increase applies. If you're following me. So it's a little more. And the other second recommendation we made was in our report that we released in the beginning of July. By the way, the industry's very unhappy with me. Very, very happy. My former colleagues and friends, and I even had a pretty threatening phone call the night before releasing the report. And it only got me more charged up to do the right thing for seniors. And I believe the industry will be okay. I've spoken to some operators on the island, and I know many operators. They will manage. They're allowed to charge whatever they want for the next person coming in. Once the person leaves, that's what they'll do. They can charge a la carte services, whatever they want. We released the report, and we think it has made the impact we wanted. Okay, so what are our next steps? We're going to do in the new year because the election had to delay it. That's why our office is kind of quiet right now in the media. We might do something in the next week or so. But otherwise we'll be pretty quiet during the writ period for sure. So we're going to do a report on long-term care, and the specific goal of this report is that the study is that you can stay in your community when you need long-term care. That example of the couple being separated in Crownville should never happen in British Columbia. We're better than that. So we're going to work on that. That's the main outcome, and the report will be focusing on this fuel demand and supply. We know there's not enough supply. What's the right number? How do we change this? The other thing we're doing is a report on ageism. I want to talk a little bit about ageism. When the former Democrat candidate for presidency, the current president of the United States, when he when they were talking about him, and it wasn't just his opponent talking about him, but in the media talking about him, saying he's too old to be president. What were they saying? They weren't saying his age, his birth year. They were saying he presents a certain way. There are many people, I don't even know his age, but there are many people his age who present a whole lot differently. And those people, I'm not sure if they can be president, they're certainly not too old. Okay? So you hear someone say that's too old, or even they say this bill, this church is too old, needs to be replaced. Because I think old's good. I think older is even better. It's kind of a human trait. But by the way, if you, as a quick digression, I just heard on the press secretary of Donald Trump speak, and her name is Caroline Levitt. She spells her name with an A. I do not spell my name with an A. I clarify that. So ageism is we're gonna look through the legislation provincially and look for anything in legislation that is ageist around like age discrimination in workplace. We're gonna look at, I just got alerted to currently I think it's unemployment insurance. There's some ageism in that. We're gonna look at anything at all. So if you know anything whatsoever where you've experienced ageism, let us know. October 9th is Ageism Awareness Day. And we'll be issuing a statement then. It's all we can do because of the election. But after the election, we were thinking of doing something where you can send in your stories, where you felt maybe you didn't get a treatment because of your age. Like there was a guy up in CARP who we met and virtually, and he's I think in his 70s or maybe 70, 69. Anyway, he is a lung transplant. So he's waiting for a lung transplant. And I was very curious about his age is the reason why he's not getting it. And because he qualifies in every other way, why hasn't he got his lung? So we did some research, and apparently it's not that. But there are diagnostic tests some people don't get. So we're investigating those. Is that because of science? We wanted, so for example, in the shingles vaccine, we want to see not just shingles, but we want to see pneumococcal, the influenza, high octane influenza vaccination, COVID, RSV. We want to see all those vaccinations like they are for kids. There's the polio and other tetanus for kids. We want to see the same thing for seniors. We want to see access to healthcare being equal for seniors as it is for everybody else. And that's an ageism can also be our biggest challenge really is ourselves around trying to look a certain way and lying about your age. What I'm talking about is and even making fun of people who are old. So look at birthday cards. Yeah. Look at anti-aging products. I would love the anti-aging products. So these are the products that people put on their skin. And by the way, if you do that, great. I'm applauding you for doing it because I also do things myself to feel a certain way. However, it will not change the year you were born. I would love to see a warning, like cigarette package. I'd love to see a warning on those products saying this product will not. So just anything to do with that, I'd love to hear from you. And we're also going to do, I promised I mentioned housing. We're going to do a report on housing as well, because we've been meeting with housing providers and we found there's major issues that I wasn't even aware of that need to be fixed. Okay, can we have a few minutes for questions?
Yeah, thank you very much. Now, what I'm going to do though is go to the chat line because I haven't had a chance to get in. And I'd like to get something from some of those that may want to ask some questions. Many of them are just sort of, yes, and I agree. You can see why we have a lot of mutual things going on. And several of the programs that Dan has mentioned are ones that CARP has been promoting for quite some time and will continue to promote, including the recent letters that went up. Here's a good example from Mark, who said there are no care facilities on Grabola. You must go to Vancouver Island, and if you have no family, you can get forgotten about.
That's on Gabriola? Yeah, that's where I spent my summers at summer camp. So yeah, you're right. Unfortunately, the Gulf Islands don't have their homes, and they're lacking senior services. Pender Island is actually doing some important work around creating supports for seniors so they can age in place. And yes, if you have advanced dementia and you have behaviors, if you present in a way that your behaviors don't allow you to stay at home any longer, then you probably will require a hearing. So that's a big challenge. But I think somewhat, if you're connecting with people in Pender Island, I think they're doing some really important work. And I know there's a whole movement around the Gulf Islands and generally around that.
Okay. The other one's simply I'm making a comment here from etc. Says reports are important and necessary, but do we really need to take action on these reports? So how can we accomplish having an effective program to push government to take action on things that you've found?
So I think what you can do and what CARP can do, and does already very effectively is, if you agree with our recommendations, and I think you agree with most of them, if not all of them, put them in your documents that you share with people who want to work this. And you'll be voting for them. So you might let them know that you're going to vote for them if things like the shingles, that you can access vaccinations. Or that they're going to build more housing, that they're going to build more long-term care, that they're going to fix some of the problems that exist. And that's what I'd be encouraging that and doing advocacy. I think the advocacy is really, really important. The people who are talking about tin cup piece, I think is important. Anytime where we can show seniors, the stereotype of seniors might be that you're well off. I heard this morning from the CEO of Beacon, who operates Shaw, that there are people in Sidney living, which according to her, living in cars. And what I also heard, because I didn't understand why a senior who doesn't have the driver's license would still need a car. And that's not the way we think British Columbia should be. I've seen that in the Kootenays. It's happening in the west end of Vancouver. We've got to fix that.
Two other ones, and I'll come back to the audience here. The one is that we promoted consistently the problem with lack of primary care physicians in the province, and it wasn't something you brought up as well. Have you had any action on those items? Are they part of reports that are coming out?
I'll just put it out there right now. Say yes, we will include that in the future. So we have this council of advisors that meets 3 times a year. So one of the, I think I mentioned, a physician, retired physician. Her name is Pat. Pat has met her for the first time in the past couple of days. So Pat is a physician in Vancouver, a retired physician in Vancouver, and she's now putting forward things like, how do we get the number of physicians, the spaces for physicians increased? You know how many physicians we train every year? We need to do more of that. Same thing with nurses and all of them. You hear politicians talk about this. We really need to actually do it, and it costs money. And by the way, if you look at the number, and the incentives have to be there to care for seniors, to be family physicians, for example. If you type in on Google, as I did yesterday, the number of geriatricians, it's a specialist in internal medicine who takes care of older people. Compare that to the number of pediatricians. It's amazing how many the difference. I think the numbers aren't quite this way right now, but for every 1 geriatrician, there's like 6. It's usually 1 in 10. I don't know the numbers, how they changed, but we need more geriatricians, for example. And we need more. We need faster flow in hospitals for seniors, but we definitely need to have more physicians, and there's reasons why that's been a challenge. But seniors obviously should have access to physicians.
One of the last question from online, and I'll go back to the audience here, and I think it's a very important one. How many people do you have working in your office? Cover all these things when you want to do the surveys and cover the province as well, and then to be able to produce the reports.
So there's 16 people in our office, and our budget's approved every year by the government. They do ask some tough questions there, and they should. And we are looking at expanding our call center. We believe that we're going to get more calls, and we believe that we can do broader job around call and referral line. We're thinking a place to go. And we do bring in people extra, like for example, when we do our review of long-term care, the survey, the questionnaire, we do have more staff, and certainly it's mostly volunteers that we do the work.
Yeah.
I'll just make a point on that point, if I may, because over the last few months I have had a lot of stand up so you can hear me. I've had a lot of contact and input Dan's office. And I tell you, it was probably the most pleasurable and best experience I've had. Forget talking to the television company or the internet company or the other places. The response I got from the seniors advocate and the good responses on the phone and in writing better than anything I've had with anybody else virtually the whole time. They have been fantastic.
Thank you, David.
You have a question?
So you write up the report on ageism,
Mhm.
will that get sent out to the membership? How will we get it? I'm very interested
Okay,
in your
well, so-
support.
Okay, so I would love it if all of you signed up for our newsletter. We have a monthly newsletter. And please give us feedback with the newsletter. Love to hear from you, and then you'll get copies of the reports there. You can get all the copies of any report on our website. But thank you. That would be, it's on the last slide, but it is. I should know this off by heart. You can see I'm still new in the job. So the website is it's easy. It's senioursadvocate.bc.ca. Senioursadvocate.bc.ca. If you type in Google, just any search engine, Seniors Advocate BC, it comes up.
And those of you who are getting our newsletter will know that we usually include a little synopsis of what's coming out with the report and then a link to that particular report as well. We've done that consistently as part of our partnership. There's a question back here. Yes, you.
No, this will do.
Okay,
Which is the best way to contact your office? So.
you got it. All right. We have a question here and then a question there. Yes.
Community sports administration, I'm told it has an emphasis on primary care.
Mm.
Is it possible for your office to advocate for that? So it's one question. Second is, have you looked at naturally occurring retirement communities at all? I understand they're focusing in Ontario.
Yeah, so Ontario's doing I think phenomenal job putting emphasis on that, supporting them, pushing them forward. And so everyone knows what that is. One of the options of seniors living. So if you think of seniors living, looking from Abbeyfield, some of you maybe have heard of or not, the different kinds. So Norks is a natural occurring retirement community. The concept is you have an apartment building or some other development where more seniors live than others, and then together they'll support people. It could be organic that they do it, or it could be through an organized. So in Toronto, Greater Toronto area, I think it's gone beyond Toronto. They've been looking at like an organization like a Beacon who would take that on, and they would serve them so they can age in place and stay there. And it kind of pushes up against licensing or some of the regulations we have around what you can do in independent living when it comes to care home. I think Norks are a fantastic opportunity to support seniors. So I'm glad you've brought that up. Thank you.
So we have a couple of hands raised here. Typing in, so I'm going to go to Brian. Can you unmute Brian and then ask your question, please? Figure out how to unmute. There you go.
Hi, Dan. I sent a question in, just curious where we're going with the trying to having to have a medical when you turn 80 for driving. Have you done any lobbying on that, or you just talked about it briefly?
So here's our dilemma. When we have if you will, space, oxygen, if you will, out in the media or with the public, to advocate for seniors, we have to be very selective how we do this. Here's a perception. My dad's 87. He owns a house in Steveston with his wife, and he can afford. He just bought a new car, and he pays insurance for the car, and he can pay, and it's a gas car. Why can't he afford $280? That's what the public will think. And why are you advocating for them when you should be advocating for other things? So that is why we haven't put. That's why I didn't put it in the first report, because it might be perceived the wrong way, because there is this whole intergenerational conflict it's not just, I think it probably is in the seniors, where seniors gain seniors as well, but there is a perception, why are you helping out that group of people when you should help out this group of people? So we're being very, very selective. So we're probably gonna go on the ageism piece around the cost of this being borne by the actual driver, the $280 or whatever they're charging, that it shouldn't be, to be no charge period. It should be a building code for MSP. We'll probably also talk about that we think that there should be driver examinations throughout life, not just towards when you become 80 plus.
Okay, thank you, Brian. Can you mute your mic then, and we'll go to Ramona?
Yes, thank you very much. And thank you, Mr. Levitt. That was a great presentation. I want to commend you on the vaccines that you are now suggesting and we're demanding that they be publicly funded. CARP has been doing this for a very, very long time. And you came out with the recommendation quite a while ago, and we thank you for that. And there are lots of all candidates meetings here in my ridings on the mainland. And that is going to be a question that is going to be put forward to everybody who is running in the BC elections. And another thing that I found very amusing was your comment about birthday cards, because whenever I see anyone laughing at the Carleton cards, I just want to go up and say something, but of course I don't. So thank you very much once again. That was really an excellent presentation. Thank you.
Thank you for the comments. And I've gone into the stores that sell them and asked to speak to the manager. Said, would you give this card to your mom? It just replace it whenever someone says something about senior, place it with another group of people who are protected under the living wage code. And then ask them if they would sell the card. And when I spoke to someone very senior at the company, as far as I could get before I had this job, I did this a year ago because I wrote an op-ed about this in the Vancouver Sun. And the response I got, it was a little patronizing to me, but basically the defense was it's a demand and supply issue. If we'll buy them, we'll sell them, and she leased that space to the card company. They say they have no responsibility, but I said you probably wouldn't sell other products. By the way, for my dad's 85th, we encouraged everyone to give blank cards. They wrote notes. He felt appreciated, he felt valued, he felt real, and it was much more reasonable. And if they do give him the other cards, I never saw them. They knew better.
Now, although we're running a little long, and we'll allow 2 more questions before I cut off the questions. So at the back first.
Thank you. Hello, my name is Lisa Cochran, I'm from Vancouver, Alberta. I do the SHMAN program at the Sheet Center. So my title is Senior Housing Advocate. I had a question for you, just the context. A lot of my clients are about 20% of seniors that are homeowners. And so because closing can take 2 to 5 years to take off conceptualization to then actually adulthood being people. Do you think there's more that can be done for homelessness or shelter services for seniors? Because due to no fault of their own, and especially if you're a manager and if you're going through a renovation, you really are at risk of homelessness. I'm finding that there isn't enough suitable homeless shelter services for seniors. So if you have anything that you can helpful for those?
Sure, thank you for raising that issue, and thanks for the work that you're doing. It's such an important role. Got me to think about, would you want a shelter for seniors in your backyard? Some of you might not want that. I'm being prickly on purpose. What if there was one in Sidney? What if there was one in Saanich, in Langford, in Victoria? We might need that. And SHINE is an organization, their whole purpose is to prevent homelessness or address it for older people, the person in the car. So very quick note, Brett Butler in 1969 coined the term ageism when he observed, I think he was president of the American Geriatric Society, a global presence. He said that they wanted to build seniors housing in a really expensive part of Washington, D.C., and the neighbors didn't want it. It sounded a lot like bigotry and discrimination. Again, if it's been a different population, so it's where this term came. And so when they wanted to build, now granted, it wasn't a shelter, it was a high-end care home. But when they wanted to build one across the street from where I live, where I own a house in Vancouver, I wrote an op-ed in the Vancouver Sun supporting it, saying yes in my backyard. My family supported it. My dad and I spoke at city council supporting it. This was before I had this job. And at the groundbreaking, and spoke there in favor. So we should have more seniors housing, regardless of what kind of housing it is. We definitely need shelters for seniors.
Yes.
And I would think if we can start thinking about why we don't want it in our backyard and start thinking why we would want a backyard, I think that will change things dramatically. And by the way, there also, if you look at how schools are being built right now, schools are in my job, I get to meet these interesting jobs, and one of them actually, his job is to replace all the schools that need replacement in BC. So I said, what I would do that for other populations for seniors, because where I live in Vancouver, the high school I went to, my mom went to, it's been replaced. The place where my kids mom went to school and all her friends and family, that school has been replaced. But in between, there's a nursing home where my grandparents have been. My dad used to be the CEO. It's the exact same. Okay, so we need to build more. We're over time.
Yeah, last question.
All the way through to the voting site, you have petitions on like this, signs, we want some more to the entries, the housing, and lots of more.
Yeah, I think you could do petitions, you could do flag cards, you could do those things, the tin cup movement, etc. We don't do that. Part of my role is actually to keep a little bit of comments. If there's not comments, that's up to you. Part of our job is to kind of provide so we probably wouldn't be inciting people, that kind of thing. But I appreciate that sometimes that does get people's attention. Can I make a final comment?
Sure.
Okay, so my final comment is
I don't want to inhibit you.
thank you. Thank you. So my final comment is to have a bit of fun with people. When someone says to you next, first of all, they ask you how old you are. Okay, it's kind of rude. But when they ask you that question, tell them the year you were born. Make them work for it. The other thing, when they say you look good for your age, our daughters tell me, Dad, I'm sorry. They just say thank you. Leave it there. But so this is what you're gonna say. You're gonna say this. You're gonna say, you look good for your age too. And then you can say this. By the way, you could also say some other advocates in other places will say you don't look good for your age. But the last one, and my dad does this now, is he'll say this when he gets the compliment. He'll say, "How do you think someone of my age would look?" Okay, so challenge people's perceptions of age and how someone should look.
Well, and you're thinking of seniors. Would you rather be a vice president or a senior vice president? Also think of that for age.
Good one. I like that.
Okay, well, speaking of fun, we have a little bit of fun here because we have some door prizes that I mentioned to you. Now, the first door prize is this little package I have at the front here, which has CARP items that to help you out when you're traveling. That is a travel diary, a CARP pen, an insulated lunch bag, a travel water bottle, and a couple pair of luggage tags. So I'm going to ask you to just grab one out of there, and we'll see who this first person is who gets that one. So this is Claire Goinby from Nanaimo, who apparently was online. So we'll have to get a hold of Claire and get this out to Claire. The second door prize is one that was provided by Iris, and it's all local products. Debbie Rasmussen, who is retiring, by the way, from Iris, has provided, it includes a basket with honey, nut butter, tinned salmon, crackers, sea salt, chocolate, even a bannock fry bread mix, and some bars of soap, and a beautiful serving board, and a lovely coffee mug. So if you'll draw for that one. My name's not in here, by the way.
You're fine.
True. And this one's Brian Hudson from Langford, who was supposed to be here.
Sure,
Brian,
there he is.
well, afterwards we'll get a hold of you and congratulations. We will tell you how you can get a hold of him. All right, so in closing, this is the closing for our current chapter meeting. Thank you very much, Dan. I think it was both inspiring in some of the ways, a little bit of what we need to be thinking about going forward, but very enlightening. Also, thank you to Melanie for arranging for the room for us here. She's the parish office coordinator at St. Elizabeth's Church, and Debbie for the gift basket as well. And to my executive committee, who's been so helpful for everything we've been doing over the time. Now, just a reminder that meetings coming up, you can find information on those in the newsletter, also on our Facebook page. And this session has been recorded. I'll turn it off shortly, and it will be available hopefully within about a week on the YouTube channel. And our next meeting will be here, and a hybrid as well, November the 13th. And the speaker is Alan Perry, who many of you probably know from CFAX Radio. And he's going to be talking about safety online and preventing scams and that type of thing. So I hope to see you all here again in a couple of months. And other than that, have a very nice day.